Hi everybody, Dr. Sia here. In today's video, we're going to talk about Corona and the fearful people, the anxious people, the secure people, and the difference between those people. And we're also going to talk about what you can do if you're feeling fearful, if you're feeling anxious, or if you're feeling secure in these really difficult days. Let's get started. All right, so it hasn't eluded any person these days that we have a virus out in the community that can be really threatening to some people and not really harmful to other people. But of course, with this pandemic, there's been a lot of changes in society. Now, what happens is that these changes and the threat that these changes propose, not just the virus itself, but as we can see now, the ramifications, other ramifications as well, like the economic impact, the job impacts, and so on and so forth, they're all potentially threatening to us and our normal lives as we go about them. Now, different people will react to the threat that Corona and the other impacts that it has. Different people will react to that differently. So today we're going to be talking about how the fearful and the anxious and the secure people will react to that differently and what you can do if you're within any one of these categories. So to understand who the fearful people are and the anxious people are and the secure people are, we need to sort of define what I mean here by fearful people versus anxious and secure. So what I mean by a fearful person as opposed to an anxious or a secure person is that a fearful person is one who is looking outside of themselves for information about Corona and its impact. And that's what fearful people tend to do. They tend to look outside of themselves on a threatening stimuli, on something that is threatening to them. So when a person is afraid of, say, for example, sharks, they tend to find a lot of information about sharks, and that information they want to soothe them, but they tend to then instead find very dangerous information about sharks, and they just get even more afraid of sharks. Now, this is the impact of fear. Fear makes us look outside of ourselves to see what is threatening us at the moment, if anything can be dangerous to us at the moment. So the fearful people are the people who have been finding a lot of information from Corona or COVID-19, and they believe that that information is, and the impacts that that can have, is threatening to them. Now, there is nothing to say that if you're fearful, whether your fear is validated or not. Only I think you can decide that. But in the end, you're going to be a fearful person if you're going to be finding information that you think is going to be threatening to you, and that information is about what you find outside of you. So if you find information about Corona and how it is killing more and more people, and that affects you, you're likely to be afraid. You're likely to be fearful. Now, one thing that is the difference between fearful person and some other people is that fearful people who are fearful in general, tend to just look at one-sided information. Like I used with that shark example, fearful people tend to just see the dangers of Corona, but not really see the other aspects that perhaps don't really pertain to them. So a person can be 25, full health, not very much at risk from Corona, but still be very fearful that they might die from Corona. And this is what makes a person fearful, is that they hear that scary information, but they might miss out on some of that information that in fact doesn't really apply to them. So in, say, a shark example, I'm just using examples here and balancing them up against each other. In an example where a person tends to be exaggeratedly afraid of sharks, they'll find that information how sharks are really dangerous, but they won't find that information that there is actually very little to fear from sharks. The likelihood of them getting any problems or getting bitten by a shark is actually very low. So they won't hear the other side of the information. They'll hear one side of the information and they'll act on that side of the information. Let's then contrast that to the anxious people. Now, the anxious people, the origin of their anxiety does not come from outside of themselves. It doesn't come from what's happening in the world. It doesn't come from sharks biting. It doesn't come from a virus that's happening at the moment and the economic impacts that it's having. The anxious people tend to be anxious because of an insecure attachment. Because of they have an insecure, avoidant, ambivalent, or disorganized attachment. If you don't know what these are, that's all right. You can Google them, or I'll be posting videos a lot more about attachment as I go along, so stay tuned. But because of, in essence, what their childhood has looked like, the experiences that they've had in their lives, they tend to have an anxious disposition. So they tend to be anxious. And the reason, the cause of their anxiety comes from inside. It comes from their experiences. It comes from their past. So how the anxious people will respond is that they'll see what's happening in the world right now. And what's happening in the world with Corona is not just going to trigger their fear, same as it does for a fearful person, but they're also going to be trying to explain this anxiety that they've always perhaps had inside as Corona. So they're going to be using Corona to understand why they are so anxious. Now, never mind whether Corona existed or not, they would find something else outside of themselves that would scare them. So the anxious people, even though their anxiety comes from inside, they tend to want to look outside of themselves for reasons for why they're so anxious inside. And I'll give you an example. Here, sharks are not a good example. Here, for example, this person, the anxious person, goes to a social situation. A person looks at them like this, waves, and they go, oh, they look angry at me. Their eyebrows were down. They were doing this. People are always angry at me. Everybody always dislikes me. So their anxiety comes from inside. They get anxious in that social situation, and then they start acting anxiously and according to their anxiety. So the anxious people in this Corona situation will be looking at Corona to explain why they are feeling the way they are feeling. They're going, oh, Corona is the reason why I'm anxious, why I'm panicking, why I can't be sleeping, because of all the dangers that it proposes. Corona is the reason why I can't really focus and I get anxious in social situations. Corona is the reason why I can't study. Corona is the reason why I can't sleep. Corona is the reason why I can't focus and I tend to panic. So for the anxious people, they will be a lot more affected by the whole thing than the fearful people tend to be. Because the anxious people, in essence, now have a double up. They have this fear from inside, this anxiety from inside that's been there for a long time. And now on top of that, they have this external reason to be afraid as well. Finally, there's the secure people. Now, the secure people doesn't mean that they won't be afraid. It doesn't mean that they won't be anxious. The difference between the secure people and the fearful and anxious people is that the secure people will see that fear-provoking information. They'll see the threat that Corona proposes. But the main difference is they will not act according to their fear or their anxiety. Secure people tend to have experienced many threatening situations in life, many anxiety-provoking situations in life, but they tend to keep a cool head about them. So they act according, instead of their fear or their anxiety, they act according to their values, according to their beliefs, according to what they think is best for them and their family members. And it doesn't mean that they take less of a risk than anyone else, or that they take more of a risk than anyone else. It just means that even though they feel afraid and anxious, they won't respond to the fear or anxiety. They'll respond to some other thing within them, their motivation, their values, their wants, their needs, their beliefs, and so on and so forth. So how would, for example, a secure person behave differently in all these situations? With a shark, they'd know the information that sharks can be dangerous, so they choose a safe time to go out and swim. They wouldn't maybe go to a shark-infested waters, but they'd go to water where it's safe and the risk is relatively low. They wouldn't want to miss out on life. Again, a secure person would recognize that if they went to a social situation that it might be someone who is judgmental and in a bad mood, but that they wouldn't let that stop them either. They'd go, they'd be happy, they'd be flourishing, and they wouldn't have any anxiety. Finally, when it comes to this corona, the secure people are not going to exaggerate the threat that corona proposes to them. They will act accordingly. They'll do what they need to do to keep themselves safe, to keep their family safe, but they won't go out. They won't be the people who went out and hoarded toilet paper. They won't be the people who go out and suddenly buy all of the meat in the stores. They won't be the people who self-isolate themselves and their families even though they're all tip-top healthy. They might even be the people who are out there right now trying to help the rest of the community. So what can we do? And again, there's no judgment here. It's just how it happens that when there's a threat, when there's a trauma, when there's danger presented, different people will behave in different ways. No judgment. It's just the way it is. So let's have a look to see what the fearful people can do. What the fearful people can do in this situation right now is that they can seek soothing information. The fearful people tend to find very scary information. They have a bias for finding danger. And what you can do, if you're a fearful person, you can start finding some safety information, some information that shows you that it won't be the end of the world. Corona is not going to be the end of the world. It's going to hurt us. It's going to hurt me. It's going to hurt you. It's going to hurt all of us in different ways, but it won't be the end. Now, so what you can do is to find some information that soothes you. So you can try to reverse that by, instead of finding information about how dangerous corona is, you can find information that tells you about how you can stay safe. It can show you information, you can look for information about the likelihood of you being affected in this situation, as opposed to the number of people who are dying in the world right now. Now, the fearful people can also seek to have a conversation with a friend or a close person, somebody who is near to them and dear to them, and seems like they have their heads about them. It seems like they're cool. A person like that can really be helpful to you right now and really help you feel safer in this environment. Now, for the anxious people, there's two ways to go with this. If you've always been anxious, and that's something that's always been within you, there is really no simple answer to that. The answer to anxiety, crippling anxiety, and chronic anxiety always has been and always will be good therapy. I don't want to sit here and lie to you and tell you, like all other videos do, that all you need to do is meditate a little bit, focus a little bit, breathe, and then your anxiety will go away. You know it doesn't, I know it doesn't, so I'm not just going to sit here and pretend like it does. If you want help, if you need help, there's ample opportunities to get therapy, even these days. If you're worried about going in, more and more therapists are opening their doors to Skype sessions these days, and I sure know that I have, and some of my patients who are anxious and do not want to go out, they are doing Skype therapy instead. So that is my number one solution. If you're feeling anxious, it doesn't matter that there's corona out there. Now is not the time to go, because of corona, I'm not going to focus on my health. I'm not going to focus on my mental health. Mental health is just as important as your medical and physical health. So get out there and get the help you need if anxiety has been crippling to you. Now, there are other things you can do as well apart from getting therapy. If you're anxious, you can also start getting the support of your friends. Again, here, it's about getting support from people who can normalize your experience for you, not judge you that you're experiencing anxiety the way that you're experiencing anxiety, and not judge you for your behaviors, but rather stay cool and calm and help you along the way. And that's in the end all you're going to need. You're going to need that support, and that's what a therapist would provide for you as well. And what you can do when you're at home is you need to disengage. If you're very, very anxious, you need to disengage from all of the information, from all of these constant news updates. You need to disengage from the newspapers, from social media. You can't keep looking at that stuff because your brain is just going to keep scaring you more and more. You need to disengage from that stuff and start doing some things that are really healthy for you. Similar as for the fearful people, start looking at positive information instead. And what you can do over and above, something that you probably don't do, is start to do healthy actions instead. Get some exercise. I know the gyms are closing down, but there are other things you can do to exercise as well. Go for walks, go for runs, exercise at home if you have to. Go to your backyard. If you don't have one, go to the balcony. If you don't have one, exercise in your bathroom. I don't know. There's probably 1,000 videos on YouTube on how you can do exercise in your bathroom or something like that. So this is my number one tip, or there's several tips that I have for people who are fearful and anxious. Now, for the secure people who are watching this video, you're probably feeling very calm and very secure within yourself right now, and that's fantastic, and that's really great for you. So for the secure people, I think what you can do is to keep up what you're doing, keep staying calm, keep keeping an eye on the situation as it's developing, but also now is the time for you to help somebody else. Remember I was saying to the fearful and the anxious people, reach out to the friend? You're that friend. So for the secure person, you're the one who needs to make yourself available right now to the other people who are afraid and who are anxious. And it's as easy as giving them a phone call, letting them know you're available, talking to them about whatever is going on, lending a hand whenever a hand is needed. I suppose not lending a hand because these days we're not meant to, but you understand what I'm saying. Helping out as much as you can help out, both emotionally and physically, with the everyday ins and outs of life. I hope that you enjoyed this video and that you got something out of it. I know that Corona is freaking a lot of people out, and rightfully so. Sometimes it is actually very scary. But in these days, what we all need to do is to recognize where we're falling, what was happening to us, so we can feel more normal in what happens for us, and so that we can start to appropriately respond to what happens to us. Finally, I just want to also say that even though I give advice to the fearful and the anxious and the secure differently, it doesn't mean that you can't engage in any of those healthy behaviors that any of the other categories did. So if you're anxious and you feel like you'd be helpful to people right now, go ahead and help people right now. If you're feeling fearful and you think you can help people right now, go ahead and do that too. The only reason why I say that for the secure people to really focus on doing that is because sometimes when we're fully anxious and we're so afraid, we don't feel like we have any resources left over to help anybody else. If that's the case, that's okay. If that's not the case, go ahead and please help out and do whatever you can do. Once again, I hope you enjoyed the video. I hope you subscribe. I hope you comment. These are difficult days, and the more that we can talk to each other, whether it be YouTube or whatever it be, we can support each other, we can normalize our experiences, and we can move forward from there. Take care for now, and I'll see you next time.